Hey everybody, this is Stuart again. I had my anterior cervical fusion not yesterday. Sorry, it's the drugs. This is my third day post-op. So it's Saturday morning. I had it Wednesday morning. So I spent one day in the hospital. The first night was kind of hard. It was hard to sleep. With the brace, of course, which I have to keep on for 8 weeks. And the doctor wanted it on, not so much that he said I needed it for 8 weeks, but the fact that you're going to start doing stuff you shouldn't be doing, so keep it on for 8 weeks. My voice is back. They said there was a 5% chance I'd have hoarseness after the procedure, and half, like 2.5% chance that hoarseness would be permanent. But all is good. As you can see, the incision that they've made, they went in from the front. They actually fused the C5 to 6 and 6 to 7, so I had 2 levels fused. And in my previous video I talked about how for every level they fuse, they say there's a 10% decrease in range of motion. So for me, they expect a 20%. When I had this off, initially, when I can move my head, I really felt like I haven't noticed anything yet. Of course, it hasn't fused yet and all that. I don't know if there'll be a difference, but at least with the hardware, I haven't really noticed a big change in my range of motion, which is awesome. So far so good. I appreciate everyone's prayers, and I know my church laid hands on me before I went into it, and man, I tell you, I really felt I was ready for it by the time they did the surgery. Staff was awesome. All the nurses that I worked with or worked with me really were wonderful. Great staff at the hospital. So I wanted to show you some of the things that they did. So the night before, in the morning of surgery, of course you can't eat or drink anything, but they had me wipe with this sponge and this type of chlorhexidine solution, and you just scrub it all over your whole body, so you're basically going as like a sterile specimen, so you're not bringing any germs in with you to the operating room. So that wasn't too bad. As you can see, I have the neck brace. You can actually pull this out and loosen it down like that to eat, or just pull it back up to tighten it, when you need that support. One thing I really do recommend is, because I get a stuffy nose, and at night I have it up and it's hard for me to keep my mouth open like that. So I bought some Zyrtec. Zyrtec is great because it keeps my nose from being stuffed up, and I can just sleep breathing through my nose all night. That's great. I know for the year they said I can't take any NSAIDs, so I knew I couldn't use my Advil cold and sinus, so Zyrtec's a great option for that. They have me on, of course, stool softeners for the narcotics they're giving me. The narcotics they're giving me is the oxycodone, and I take some acetaminophen with that, and that's like a Percocet, and that helps me to sleep at night, which is great. It also helps me to I take it about half hour to an hour before I eat, because swallowing is really one of the most difficult things. I don't know if it's my throat so much, or if it's just the tension of the back of my muscles in the back, even though they didn't do anything, they're just really tight. And so I do have a muscle relaxant for that as well, but I haven't taken that yet. I just kind of stick with the acetaminophen and the oxycodone when I need it, or just the acetaminophen. And the other thing is that you guys might want to remember, when you go to the hospital and they give you, you're going to come out of surgery with this collar, and you want to ask the OT, the occupational therapist, for some more of these. These are little, more of the little sticky foam things for the inner lining of this, because as you start to eat and get all nasty, you kind of want to change it. So having an extra pair of these is great. She actually gave me 2, which is awesome. And they also give you this neck brace for when you go in the shower. So you alternate between that and this. This is pretty firm too, you know, I really like it. It's very comfortable. So the only thing about the collar that's, you know, as I started to, I did shave yesterday. I just put some tape, and you can get plastic and put that over there so it's not dripping down into the wound. You know, because your hair starts to grow into this and it just gets really itchy. So that's, you know, I hope that helps for you guys. You know, it was a real positive experience. For me, I haven't had any issues. I've been walking around the neighborhood. You know, even the second day, once I got home, I started doing a little walking. So I hope that helps out. If you guys have any questions, you can always email me at stewarthoward@yahoo.com. And I hope this helps. All right, God bless and take care.